We have 10 minutes now for discussion, and so I would like to invite any of the roundtable members or any of the audience members to go to the mics. We have until about 10 minutes, but while people are getting up, I'd like to ask any of our speakers if you have anything that you want to respond to or react to from any of the comments from your co-presenters.
Amen.
I endorse.
Yeah, I agree. I think the four different things that came up are all key to moving the field forward.
Do you want to just recap, Deb, what you...
Yeah, the four. The first was that we need to focus on getting parents and providers to work together, and we need to do some piloting of innovation in that area and then spread and scale that. The second is that we need a national monitoring, I'm not saying it as well as you would, a monitoring and surveillance plan. The third is that we need technical assistance to focus on physical activity in a variety of fronts, and the fourth is to really both expand CACFP but also really enact the Hunger-Free Kids Act.
Yeah, I think that's true, and I think that really one of the key things that I heard is this issue of sustainability, which you started with and you talked about and I did as well. You know, it's really important to pick strategies and to focus on things that are going to be sustainable. And I really think that all together that we all covered that important point, because too many times, I think particularly in low-income, communities, people might come in and do something really nice and then they go. It's not sustainable. And so I liked that theme that you started and you talked about and I picked up.
One of the challenges that I've seen in early care and education compared to schools, which I think if you look at obesity prevention efforts in schools, that they really are far ahead of where early care and education is. But with early care and education, it seems like you're trying to impact not only the localities and states, but also the structures are so different with family-based care and child care centers. Do you see in the foreseeable next 5 years, 10 years, that there'd be universal child care?
Yeah, well, I think.
And do you think that would be helpful?
The current administration is certainly working towards, increasing child care. I mean, when I talk to the child care, experts, they're actually a little more concerned about a downward trend, a kind of opposite trend in quality and money for quality and money for enough children to be served, for example, through the subsidy system on the state level. So I think that they would like universal child care, but the resources that it would take to put behind it. I think one of the other issues that related to your point, Mary, about universal child care is whether we would ever see federal standards for child care as opposed to this hodgepodge of fights on the state level. I think that's a big issue, and the child care people have been trying to get federal standards. They've not focused on nutrition and physical activity, but I think
that's what's helped schools.
Yep, exactly.
Is having those federal.
That's right, and I think if we, look at some of the other ways that we've been successful in schools and other places is by being able to take a federal approach. I think that's one of those opportunities where the people who are really focused on nutrition and physical activity, who have quite a bit of political power, the industry people, a lot of the people that you have in the roundtable could come together with the child care people who have actually been working so hard to get national standards that are of interest to them. Bring that together and make that one of the things. I mean, I think it's a really good question, Mary, because we do have to work so hard on each state to figure out, in Delaware, of course, you did a wonderful job, and then you see your list, but you're trying state by state, the CDC is, and you've done great things in North Carolina. But we always know, and from what we saw in the opening, if we can get federal standards, we're better off. And I do think that's a roundtable, that's an important thing for the roundtable.
Can I just add that I think we need to do both. We need to really maximize on the federal opportunities, and CACFP is one of them. We also need, because childcare is so decentralized and it works so differently in every state, we really need to empower the communities.
Right.
Yeah.
And really continue to consider ways of financing and sustaining efforts at the community level, because in childcare, that's the hard work that needs to happen.
Right, and I think Dianne did a good job in talking about the CCR&Rs because they're a pivotal place, I think, to do that kind of organizing.
Thank you. And we have about 5 minutes left, but Jim, if you just want to make your comment or question, and
Okay.
if we could have them short since we have 3 people.
Yep. Jim Salas from UC San Diego. I'm on the roundtable. And my question is triggered by Diane's comments, but I'd be open to responses from anyone. All right, in the roundtable, we're challenged to get to action. How can we make real progress? So Dianne, your suggestions of monitoring, implementation of nutrition and activity policies in childcare, and then providing technical assistance, I think are fantastic. What are ideas about how we could actually pay for that? How is that going to happen? Are there any models that you can think of that could be applied? Or any funding sources?
Well, obviously, the devil is in the details, and that, Geri and I were not given a time frame nor a budget to work with in terms of our opportunities. And so I don't really have particular ideas about how a monitoring program could be paid for, but obviously Bill Dietz put forward some strategies in the sugar-sweetened beverage tax theoretical, or the advertising stipends that could possibly be utilized to roll into some sort of monitoring program. But I have to say I don't have the answer to that very difficult. Maybe Debbie has an answer.
I don't know if I have the answer, but I do have a response, which is that I think what we need to do in the absence of what I think what your point is right. I mean, it's hard to find the funding for this. But in the absence of that, there's a lot of efforts that are going on right now, and we need to build the technical assistance piece that Dianne talked about into current efforts. So, for example, we have we're leading a national collaborative that includes physical activity. We're doing work with the American Heart Association, a technical assistance program on the ground. We have physical activity as a part of that. So I think there are lots of current efforts, and we have to build in that technical assistance into those, or to focus on physical activity into all those efforts. Let's Move Childcare is another one that also has physical activity as a part of that. So I think that's what we can do in at least as an initial response.
I think we just have time for one quick comment or question, and then I think the speakers will all be here after the session during the break, so there'll be time for other engagement.
Okay, Dave Fukuzawa, Kresge Foundation. So there's enough work just within organized ECE to get this done. I'm just wondering what your thoughts are about the sort of the unorganized, the family friend and neighbor networks, which largely serve low-income populations.
Well, one of the things that I think is an interesting development is that HHS, and they may talk about this when they're coming, they put out new standards for all subsidized care, which would actually include informal care as well. And they were expecting there to be training and education on nutrition and physical activity. So I think that's an interesting standard change in terms of looking at how you could get to informal care, because a lot of informal care participates in the subsidy program. The other way that we've worked on it, just to be brief, is that FRAC has really spent a long time, 2 decades actually, trying to work to expand to get CACFP into informal care homes. And so in most states we now have that. That's an important way to get oversight and support, because CACFP visits those homes at least 3 times a year and looks for the nutrition standards and gives them support and technical assistance. And so from my point of view, I think those 2 things are important, but I know that the other people here have done some important work on that area.
I guess the other 2 things I would say is certainly the National Association of Family Home Care folks are a great resource, and in terms, because they do get together annually, and that's a good spread mechanism. But more to your point, David, in our National Learning Collaborative, we are going to be looking specifically at the family care setting, and so we should get some more knowledge about that. It was one of the areas I mentioned as a gap that I think we need to focus on.
I'd like to thank our presenters, and we will move on now to the next session. Thank you.